Lakha. Yeah, Shanaz Fatima Lakha. She noticed our little project, and as we were showing it at a conference, and we essentially talked over some of the things that were very similar. And the consensus is that there is a very specific amount of need for this support, as you mentioned. But the weird part is that the barrier are the doctors themselves. Because most doctors, as you mentioned, are quite old. They don't really understand tech very well. And anything related to this is difficult for them to even get into. Even some of the newer students or some of the newer residents that I worked with had the same problem where they just had such a specific understanding of what kind of tech they wanted to work with. Now, what I can do for this situation is quite interesting. Since I'm working with AI currently, and one of my ongoing jobs will be with agentic AI specifically. What I can propose is that we can discuss what we can do together. You mentioned that you have a separate part of your business where you can use for promotion or for input, or even as an open source project, which is also a very interesting approach. So that's my question to you. With all this context in mind, where do you think you can make use of my time and how I can help you? Because I'm not asking for money here. I'm just asking to participate, potentially help you further this, because I also agree that this is something that is necessary. But there's a lot of layers to this that need to be done in a way that does not flag the patient or does not compromise local information. There's some security issues. There's obviously some fine-tuning when it comes to the actual conversion models. So there's a bunch of things that can be done to make it better or make it just more accessible. Up to you, of course.
So let me just tell you, the first clinic that we worked outside of my own clinic was a pain clinic, actually. So our system exists in l'Hôpital du Richelieu. They're chronic. So this is a clinic within the hospital itself. And so it's funny that you're the first representative, by the way, to which I open out our system and that has found interest for it. So there are environmental challenges, and there are environmental challenges that pertain to the patient, and there are environmental challenges that pertain to the physicians. One of the biggest challenges, and there are challenges at every step of the way. Pain clinics is a very hard type of medicine. It's hard because communication needs to be on point. So whenever you bring these guys that are doing all the work and that is very time consuming, and you give them something that resolves a lot of this process, the communication aspect of the medical consultation is the most important part. It's way more important than the physical examination.